Identification of various electrotherapy treatment materials. These materials, what is this, names of these materials, and some names of the areas here. 2. Identification of anode and cathode. If you see, there is two things, black and red. So out of this, which is anode, which is cathode? What is anode, what is cathode? That's what we are going to see. Okay. 3rd, self-testing, or testing by yourself and knowing that machine is working or not. This is called as self-testing. We will see for two currents, Faraday current and galvanic currents. Okay. So these are the 3 practical criteria for this class. The first one we will start with identification of various electrotherapy treatment materials. For example, goes with very grossly, definitely you know this is bed, and definitely you know these are pillows, okay, and towels. These are called electrode covers, okay. This is electrode and this is the cover, electrode covers, okay. These electrode covers are usually they are made up of sponge, okay. Why sponge? Because when you use the sponge, they absorb the water. When you put them inside the water, they absorb the water and they keep the water. Why they have to keep the water? We will see. Okay, they keep the water. Huh? Okay, these are the covers, electrode covers, and these are straps. What are these? Straps to tie the electrode and secure the electrode to the skin. There are 4 types of electrodes which are available here. One is carbon rubber electrode. This is called as carbon rubber, made up of carbon and rubber. This is called vacuum electrode. Vacuum. It will give the vacuum pressure. So this is vacuum electrode. This is anal electrode, which is kept in anus for stimulation of anal muscles. There are vaginal electrode, there are anal electrodes to stimulate anal muscles and vaginal muscles, to stimulate defecation process and to stimulate pelvic floor muscles. Okay? And this is a pen electrode. It's like a pen. Okay? It's a pen electrode. So it's like a pen electrode, carbon rubber electrode, vacuum electrode, anal electrodes. So these are the 4 which are available here. Now, any doubts in these names, electrode names? Any doubts in electrode names?
It's about wire.
I will tell you about wires. Okay, first know the electrode types. So after that, the wires. The wires are 2 types of wires are available. Okay. One type of wire, this is a connecting lead. This is called as connecting leads between machine and the electrode. This is a connecting lead. It usually appears like this. 2 pins and 2 holes. 2 pins will go here. Okay? Go into the 2 pins will go into the electrodes. They go here. 2 holes will go here. 2 pins will go to the electrodes. If you have electrode, the electrode will have a hole and it will go to this. You can put for any. We have spoken bed, pillows, towels, electrode covers. These electrode covers are made up of sponge to attract the water and keep the water with them, and straps, various varieties of straps to secure the electrodes onto the patient's skin. And there are 4 types of electrodes: carbon rubber electrodes, vacuum electrodes, anal electrodes, and pen electrodes. The more than this also available, but they are not available for you here. There is aluminum foil electrodes, there is metal electrodes, there is vaginal electrodes, there are oral electrodes, many types of electrodes, but whatever is there, it is here.
4. Now 4.
Now 4, that's it. Now the connecting cable is a connecting lead or connecting cable which connects between the machine the machine to the electrodes. It connects between the machine and the electrodes. Each connecting cable should have two. Okay, should have two. One anode, another cathode. Okay, anode is positive, cathode is negative. In case of direct current. In case of alternating current, it keeps shifting. This will be cathode, this will be anode for some time. It will be changing. Okay, but if it is a direct current, anode positive, cathode negative. In this machine, anode is red, cathode is black. Okay, anode is red and cathode is black for this machine. Now, two electrodes, that means you have anode and cathode coming from two outputs. So, these two together is called as one channel. One channel will have two electrodes, one anode, one cathode. So, this is one channel, channel 1, channel 2. So, that means you have 4 electrodes you can keep at any time. Two channels you can use, or you can use for two different patients. This channel for this patient, this channel for another patient. Possible.
Two patients. Same
You can use. You can use here vacuum electrodes. I will show you vacuum channels. So this is the connecting cable for normal electrode, carbon rubber electrode. Okay. Now you have vacuum. You have vacuum. Vacuum means when you apply the pressure, you know vacuum cleaner?
Yeah.
Vacuum cleaner. So similarly like this, it applies vacuum. It gives a vacuum and it sticks the electrode to the skin. So this is a hole. It's a hole.
Yes.
Okay? There is a pressure which can be applied. So this vacuum has to be applied to the electrodes. See the hole? So this vacuum will be applied to the electrode.
To catch.
So to connect it. And this vacuum electrode will go to here. So there is also a hole. There is also a hole. So when you switch on the machine, it gives a vacuum. And this electrode will stuck to the skin. That's why they are called as vacuum electrodes. So this is the lead for vacuum electrode. So I will keep two leads. One for carbon rubber, one for vacuum. You should be able to identify which is the vacuum electrode lead and which is the carbon rubber electrode.
By the hole.
Huh?
By the hole.
By the holes, yeah, by the openings. So now you understood the connecting leads between machine to the electrodes.
So can you again, where, what,
Carbon.
no, not carbon, yes, this.
This is vacuum. Here carbon rubber. Here vacuum. Vacuum also, this is one channel, this is another channel. Any channel, one channel means it has two elements. One positive, one negative. Positive is anode, negative is cathode. Okay? So here, this is the negative cathode. The cathode. And this is one channel. One channel has two electrodes, positive and negative. Positive is anode, negative is cathode. So now this machine has another setup. This is for ultrasound. That is different. You already finished it. So here A and B, two ultrasounds can be done at same time for a patient. So you can put ultrasound like this, and so that means you can use two ultrasounds for two different patients and two channels for two different patients. Total 4 patients you can treat at same time. Okay?
4 patients.
You can treat with one machine. So here, now if you come to the other part of the machine, other section of the machine back side, usually it has on and off machine, on and off button, and it has another cable. If you see, it's a 3-phase cable. Say 3-phase cable, 3-pin cable, and it is a connecting wire. Okay, this is a connecting cable between machine and your home supply or the supply, electrical supply. So this cable connects between machine and the home electrical supply. Usually there is an inbuilt fuse. Inbuilt fuse means, fuse, which burns up. Any excessive amount of current comes, it will switch off and it will stop the current flow and prevents the damage of the machine. Okay, any damage happens to machine, that will be prevented by the fuse. So this is a power supply, power cable should be attached. This is a power cable. Okay, this is a power cable, should be attached to the machine. So that is about different parts of the machine. When we go to individual machine, I will show you more parts, more related parts, and definitely you require something called, this is kidney tray, because it's like a shape of kidney. It's called kidney tray, water, and sometimes you require gel. Some machines you require gel. So that gel is not there here. I will show in the next classes. You'll get it from down and I will show you. So there is gel, water, kidney trays or any other trays, towels, tissues, straps. These all are the materials which you require for stimulation of electrical current to the patient. So for that you have to do a small experiment to identify what is anode and what is cathode. So first take a towel, okay, keep the towel on the bed or on the wooden material, okay. Then you choose the two electrodes, what you want to find out. For example, in this machine, how you know which is cathode, which is anode? How you know? How you know?
Black.
Yeah, because I told you. Otherwise, when you go with some other machine, how you will come to know? It's not always color dependent.
Yes.
It is not compulsory that black should be anode, red should be cathode, nothing. Because some other country they put green and another color. So that is the time you have to know this small experiment to know whether it is cathode or anode. So fix the electrode to the machines in respective colors. So I put black to black, red to red. So now two electrodes are, one is red, okay, one is black. Yes? Two electrodes are there, one is red and one is black. Okay? Red, black. So this is red, this is black. So I will put this, both of them inside the water. Okay? I will put both the electrodes inside the water. Huh? No, gel you cannot. If you want to find out, it should be in water. So put both of them in water. Now go to the machine. Okay, when you switch on the machine, it will show this list. Okay? Now you go to electrotherapy. You go to all current waveforms. Then you go to galvanic current. Okay? In the galvanic current, we want galvanic continuous. If you remember morning class, there is interrupted galvanic, interrupted direct current, continuous direct current. So we want continuous direct current to identify which is cathode and which is anode. Because if it is direct current, the current will start from electrons, electrode negative charge, and will come to the positive charge. So that's why we choose galvanic continuous. Choose. So this is one channel, this is two channel. Choose any one channel. I will choose one channel because I have connected to the one channel.
Yes.
Okay. Now current is galvanic continuous. No other current you are not supposed. You are supposed to use. You have to use only galvanic continuous if you want to identify cathode or anode. Treatment time. Just put for 5 minutes. Within 5 minutes you will come to know. Electrode selection.
Always 5 minutes.
No, only for this experiment. Only for this experiment, choose 5 minutes to know which is cathode and which is anode. Electrodes, if you see here, this top one is for carbon rubber. This is for carbon rubber. And this one is for vacuum. Okay? So we have used now carbon rubbers. So select carbon rubber. Polarity, no problem. Positive or negative. Output mode, continuous. Okay? No problem. So now switch on here. And if you see here, milliamperes. That means intensity. Amplitude or intensity, milliamperes. So increase the intensity. Put it some 20 to 40 milliamperes. I have kept 35 milliamperes. Okay. Now you see what happens inside the water. Okay. Now what happens inside the water? We have to see it. Just wait for 2 minutes. Don't touch the bed.
Don't touch. لا تلمسيه. حاضر تكلم.
شو يصير؟
بتسخن.
اتوقع انها تحل الموضوع.
لا تتوقع.
So if you give some light, your video will be better. Just give some light.
نشوف البخار.
شفت انت يا ولد انها تحل الاكسجين. ايوه تحفيز الكهرباء.
Okay, if you see now, one electrode has more water bubbles. See clearly. One electrode has more water bubbles.
لا يحل المويه يفرق الماء. الهيدروجين ولا
Yeah, this
رايت
one.
ون
ايوه شوف ذاك الاكسجين
ليش رايت؟
رايت
رايت.
No.
This right.
This.
Okay, this electrode. This has more water bubbles. This is left. This is right. Okay? Left. So this electrode has more water bubbles. Whichever electrode is producing more water bubbles, that is cathode.
Cathode.
Okay? Negative.
More bubbles.
More bubbles, cathode. That is negative. The other one is positive. Automatically it is anode. Okay? So if you see here, colors.
Clear.
If you see the colors. So the black one is cathode because it is producing more water bubbles.
Not
This
all
one.
this time.
Huh?
For a different machine, maybe.
Different machine, no problem. Colors, no problem.
Yes.
But whichever electrode produces more water bubbles, that is cathode.
By this
The
I
other one?
can determine.
By this you can determine which is cathode, which is anode when you have confusion. When you are using machine, you don't have any manual, you don't know which is positive, which is negative, then this is the way you should treat. And why to identify cathode and anode? I'll decrease the intensity 1 minute.
Stop.
Yeah. Okay. So now this experiment finished and you know what is cathode and which is anode. Why we should know which is cathode and which is anode?
كاثود نيجاتيف.
Okay.
Bubbles.
انود
I know that, but why you want to know?
Yes.
واي because cathode he take the hydrogen.
Yeah, that is bubbles. We are talking about hydrogen bubbles.
I said it.
Okay, if you remember the polarity of the nerve. Inside, what is the polarity? Positive. At resting membrane potential, inside of the nerve or inside of the cell is positive, outside is negative. So, when you take cathode and apply onto the nerve, cathode will give electrons or positrons?
Electrons.
Electrons are negatively charged or positively charged?
Negative.
So when negative charge is given to negative charge, what happens?
Problem.
What problem? Repel or attract? Repel. When it repels electrons, what happens? Electrons will go inside the cell. More electrons will go inside the cell. So when more electrons go inside the cell, there is a difference in the potential and there is a stimulation of action potential. Okay, so cathode has to be on the muscle if you want to stimulate better. When you keep anode also, same thing will happen. Anode will pull more positive ions from inside the cell, but the problem is cell permeability. Cell do not permit that much easily positive ions to go outside. So you can still stimulate, but the effect of stimulation is usually weaker when you put anode on the nerve than cathode on the nerve. That's why here when you stimulate the nerve, the cathode should be the active one, active electrode which should be treated or which should be kept on the nerve or muscle should be cathode. Okay? The opposite one or the ineffective electrode or adjacent electrode, anode, will be there in another place during the stimulation.
First cathode.
First cathode. Cathode for stimulation of the nerve or muscle.
Good.
Okay? So this is why you should know which is cathode, which is anode.
When I should use the...
There are some types of currents. When that specific current comes, that time I will tell you. For example,
time machine.
huh?
Different time machine.
Different types. There are different currents, no? That time you use anode as active.
Depend on the machine?
Depend upon the current. What current you are using on the patient.
Okay. Don't put anode.
You will put anode also, because if you don't put anode, how the circuit will complete? Circuit has to complete, no?
Yes.
So when the electrons are given, should go back to the anode.
Cathode anode.
Cathode, and both will be kept, but cathode will be kept on the area of stimulation. For example, you want to stimulate biceps muscle. Which you will keep anode here or cathode here? Cathode. So you have to keep cathode here, anode on the other area, adjacent area. Okay? That's why you should know which is cathode and which is anode. There are some machines where you have to use anode, you have to use differently. That I will tell. Where you have to use differently, I will tell when it comes to each machine. Clear? So this is second part of the today's class. Identification of cathode and anode. The first part was identification of different materials and their names. Second part is identification of cathode and anode. Now the third part. What is the third part? Self-testing. Before self-testing, I want to show you how to decrease skin resistance. Today we have four criteria. The next criteria is how to decrease skin resistance and why to decrease skin resistance. So now this particular part is about how to decrease skin resistance and why to decrease skin resistance. Can you keep your hand here? Yes. Can you remove this thing? Yes. So when you want to stimulate the skin, as I told, skin is a dry material. It has oil and it has dirt inside it. And skin pores are usually not conductive for the electrical charge. They are all insulators for electrical current.
Yes.
So you want to make, now because you have to go inside the body. When you have to go inside the body, skin has to permit the current. If skin don't permit the current, because it is a resistance material, the electrical current will more accumulate and it will cause burn or damage in that particular area when you don't decrease the resistance of the skin. So this is the reason why you have to decrease the resistance of the skin. This is one of my commonest practical question I am telling you. Why to decrease resistance of the skin? Because, I will tell again, skin is an insulated material. Skin has sebum, skin has oil, skin has dirt. Skin pores do not allow the electrical current to go inside because it is a dry material. So you have to go inside the skin because you are going to stimulate a muscle or some structure under the skin. So you have to decrease the resistance of the skin. That is the reason you have to do this. So the next step is how to decrease the resistance of the skin. The first thing is you have to remove all the metals related in that particular area. Here, this one no problem. Here, any area, for example ring, that is a problem. Near, whatever materials are there, you remove. Now, apply the water. Okay? Apply the water as much as possible. Why I kept towel down? Because more water, it goes and absorbed by the towel. So, apply the water as much as possible. Okay? Even the electrode which you are stimulating, I am going to keep it. If I keep like this directly, after some time what happens? The water will dry.
Dry, yes.
Okay? My treatment is 20 minutes or 30 minutes. So till 20 to 30 minutes, I want water to be there at that particular area.
Yes.
Because more water, it is easy for the current to go inside. Yes. So that is the reason I use a electrical cover, which is made up of sponge. So it will keep the water inside. Okay. It keeps the water continuously. And if you see this, 1, 2, 3. And if you see the electrode, there are two surfaces for electrode. Can you see here clearly? This is end of nonus written here. Can you see?
Name?
End of nonus.
What is mean?
That is the company machine name.
الشركة.
The name of the machine. You have to use the other side. Then the effectiveness will be more. If you use this side, the effectiveness will be less.
Yes.
It won't pass easily. So this side should touch the skin. Okay. So in between this electrode and the skin, I require at least two sponge layers.
Too late.
2 layers. So I keep, okay, into this. So I know now this is the contact area, 2 sponge layers, water is there, and I keep it on the skin.
But the name of company under.
No, it is up.
Let's تعمل special.
Okay. So
Doctor, what time?
So now this is one way of decreasing the skin resistance. One way of decreasing skin resistance is apply the water, dip the sponge material inside the water, and put 2 layers of sponge between electrode and to the skin. This is one method. Second method, if you don't want water, if water is very fussy, some patients don't like. Okay, at the time you use gel. Okay, you use gel. There is liquid gel and there are gel electrodes. Okay, for this only there will be electrode comes with a gel coating of the gel. So you have to just go and press it onto the skin. That's it.
Only.
Without water. If there is a gel layer,
Here.
okay, here, then directly you can apply gel layer. Or if you don't have gel layer, you have only electrode. So that time you apply liquid gel, like ultrasound, when they do ultrasound they apply gel. Similarly you apply gel here and you keep the electrode on the gel.
Gel is good.
Okay? So this is second way of decreasing the skin resistance. Third, sometimes some people will have more hair. So much of hair will be there. So as you know, hair is again an insulator. Okay? Hair is an insulator. You cannot conduct the electrical current very easily. And if you want to stimulate that muscle for more time, like 6 weeks, 10 weeks, you want to stimulate, every time the hair will be a problem for you to stimulate the electrode. So that time, shave. You have to shave the area, whichever area you are applying the electrical current. Okay? Shave. Okay? So shave the area for skin, then you can apply. Smile. See, show
How
me.
much is the length?
See, this much, no problem. Can you open the forearm? Open.
شاعر يا
Okay, here you have to shave.
Most or
For more time, for example, if you are using for 10 weeks,
لا تسمن بعد مور.
okay, it is better to shave.
صدق خلاص الوجه.
Your treatment will be good.
شلها كلها.
Okay? Fourth variety, Shabab. Fourth variety, sometimes after the cast, gypsum, after the cast, the skin becomes thick and there are so many layers will come on the skin. Okay? That time you have to,
Some black layer.
yeah, black layers, white layers, or sometimes foot, feet.
Yes.
Okay, there is thick skin. Okay? Very thick skin will be there. That time you have to scrub. Scrub? Scrub. Okay? You have to scrub the skin. So you have to scrub the skin so that excessive materials will go. Then you can apply the electrode. This, which is very rare. Scrubbing is very rarely we do for patients, unless it is very, very limiting our treatment capacity. But most common ones are either water or gel. These are very two common varieties. Shave and scrub, they are not done very common. Okay, unless you require lazim, definitely. More number of treatment durations. You see that patient is going to come to you, then you do it. Yes. So when you want to self-test, Again, take a towel. Okay?
Yes.
Keep your hand onto the towel. You want to use cathode and anode. Okay, 2 electrodes if you want to use. So this is cathode,
Just
this is anode. So I keep
inside.
inside, put water, sufficient amount of water. Then I keep my hand on that. The other one is, I take another electrode.
ليش ما عليه 3 طبقات؟
عشان ما تسوي كرارة.
يخاف على موش.
كل واحدة طبقة.
دي طبقتين.
هاي طبقتين هاي طبقتين.
So I keep like this.
طبقتين.
دكتور two layers in cathode.
Yes. Whichever touches my skin should have 2 layers.
طولة.
ايوه واحده من تحت واحده من فوق
Okay.
اللي تلمس جلدك.
So wherever my skin touches the electrode should have 2 layers. So now I'll just show the machine how to select, then I will start with the current. So go to electrotherapy, muscle stimulation. Okay, Faradic current. Yeah, this is self-testing. So rectangular, channel 1, treatment time, just to show the time, so 5 minutes enough. See the pulse duration, pulse interval. See, I am increasing pulse duration. So it's a 1 second stimulation, pulse interval okay.
نقل.
So electrode selections. If you go to electrodes again, so I am selecting here, it is good. Okay, now I am going to start. So I keep.
Doctor, muscle disease has have chronic or acute or only chronic?
In the muscle disease, there are many types muscle disease, chronic, acute, many varieties. So I'm going to stimulate my thenar muscles. Okay? So I'm increasing. Can you see my hand?
شوف شفت
Okay?
Pain or no problem?
There is electrical current.
انت
It's not pain, it's a new stimulus for you. You are going to feel it.
Doctor, you're doing that?
I am not doing it. It's current which is doing. Okay?
كان يجرب
It's done by the
كان
machine. You will, 1 minute. Once I finish, you are going to do, everybody is going to. This is self-testing. Whether current is coming to the me or not.
اللي
Whether machine is proper or not. Okay?
سحر دقيقة يا دكتور
Yes.
سحر
So decrease. So by this I came to know machine is working. Quite, no problem. So then I can apply to the patient. If I am sure, then I can apply to the patient. Okay. Huh? If it is not working, then I have to check where is the problem. Whether this part is problem, whether this part is problem, whether output only is problem. So how to check that? Good question you asked. So if I feel no current is coming, okay, both are electrodes, I feel no current is coming. What I'll do is I'll change electrodes. I'll take another new electrodes and see. Okay, still no current coming.
Check another.
No,
Doctor,
2 cables you check. So still you don't feel the current, then you hold like this. Little intensity is in your hand. You know how to control. So check it. If current is coming here, then this has no problem.
But if I want to try this intensity, how much will it?
It's all intensity is all depend upon you. How much to increase. If you feel the current, that means it is there. Okay, you need not increase up to 17, 20, nothing like that. If you feel it, then it is there. Okay? If you don't feel it here, Shabab, you don't feel it here. Then remove. Actually, you have to put it here.
The fingers. The
Okay,
fingers
but
takes-
here it is. Electrodes are deep. You cannot.
Yes.
Okay, so
شيل
you
no
can
problem.
use the tester,
هذا اسمه
the tester which glows. Okay, you can use the tester. So the tester will glow. The current is coming here.
دكتور no problem change.
You can change, but you want to make sure whether this is working or not. All the machines don't come with 2 channels. There are some machines where only 1 channel will be there.